himself to be before, feels that it's not so sharp as he was before. General weakness of memory and weak concentration. All these symptoms burst up after a distressing episode of infectious mononucleosis. You know this disease, all of you? Infectious mononucleosis is a disease caused by a virus. The virus is Epstein-Barr virus. And the symptoms are like a severe throatache, tonsillitis, high fever, lymphadenopathy, and in some cases the spleen becomes large. You have splenomegaly or also hepatomegaly. The hepatic enzymes may become high, and the patient feels very bad. The patient condition is not good. It's not a normal, for example, throat infection. It's a very systemic disease that usually is confused with normal bacterial throat infections. In children, maybe this condition is confused with sometimes with streptococcal infections of throat. So mistakenly are treated with penicillin, which causes some side effects in those patients. Some rashes come out, and these rashes are known as penicillin rash. And that penicillin rash points to the diagnosis of infectious mononucleosis. Usually in children with less than 5 years old, the infection is asymptomatic, no symptoms. Between 5 to 15 years ago, 5 to 12 or 15, it may be shown by normal throat infections like streptococcal infections, but usually after 12 to 15, which is rarely seen in Asia, Middle East and Asia, because the rate of this infection in Middle East and Asia is very high. About 90-95% of patients are infected by this virus, but maybe asymptomatic infections. It's also caused named kissing disease because it is transmitted by saliva when kissing the babies, newborns. So, all these symptoms burst up after this distressing episode of infectious mononucleosis when he was 17. The details of IM is the abbreviation of infectious mononucleosis, cannot be recalled by the patient. It means that when you ask the patient, okay, after that period of that infection, you do not feel well since that period. You ask, okay, tell me about the details of that infection. He cannot recall because it is about 20 years ago. The time of coming to office is when he is 37 years old. So, all he remembers is that it was awful, reporting some general and typical features of IM. I mean, throat infection, throat ache, tonsillitis, and malaise and such symptoms. Other important symptoms appearing after the IM turning point were cervical lymphadenopathy, almost always present, fluctuating in severity. It means, cervical is related to neck, the lymph nodes of neck. Since that period, there was always some problems with these lymph nodes. Sometimes swollen, sometimes normal. Lab tests regarding WBC, white blood cell levels, ESR, are in normal limits. His TSH level is normal. TSH is thyroid stimulating hormone, the hormone that is secreted from hypophysis in brain, that stimulates the thyroid gland to secrete thyroxine. It's within normal limit, but in its high scales, it is something around 3.5, 4. He is susceptible to recurrent pharyngeal infections, sometimes exudative, sometimes not. Means that after that IM, he has experienced many attacks of normal streptococcal infections. For pharyngeal infections, not necessarily streptococcal. Exuda, means that the tonsils are covered by the white pus. This is exudative tonsillitis or exudative pharyngitis. So, a mild throat pain is always present, which is sharply aggravated by talking. It means that when the patient is not suffering from infectious pharyngitis, is also somehow always is suffering from a problem in throat. And this is aggravated by talking, is worsened by talking. He is a warm-blooded person, no toleration for warm weather. And this is also a post-IM feature. Post-IM feature means that after the IM, he is experiencing this symptom. After IM, infectious mononucleosis. A talkative and anxious type of person who craves outdoor walking, which greatly palliates his anxious nature. So there is always an anxiety with the patient. But going outside and walking makes the anxiety better. So, all of you wrote down the things? Yeah? Okay, so I give you 10 minutes, okay? 10 to 15 minutes to work on the case. Group working. So,